About 2 years ago, I was on trauma call, and I get paged by the emergency room that a young 18-year-old had gotten stabbed in the face, and he was about to get a CAT scan. It takes me about 5 minutes to get to the emergency room, and about halfway to the emergency room, I get another call. This time with a frantic voice exclaiming, "We need you now, we need you now." I rush over to the patient, and I see a young man lying on the stretcher in a pool of blood. Blood is literally projecting out of the side of his face with every beat of his heart. It is spraying across the room and hitting bystanders. The young man is screaming in pain and starting to lose consciousness. Turns out he was stabbed in the face with a piece of metal, and as they were moving him around to get in the CAT scan machine, the metal in his face moved and it nicked his facial artery, which is one of the major arteries of the head and neck, and this young man began to bleed profusely. I immediately yelled for people to get out of the way, and I asked a nurse to put pressure on the wound. I grab another doctor as a second pair of hands to help clean the wound and keep it clean, while I grab a suture kit, throw a series of quick deep stitches while guessing where the artery is, because I can't even see the thing. It's bleeding everywhere and gushing blood as we know it. This somehow manages to slow the bleed, and he is immediately rolled to the OR for repair of the facial artery. Thankfully, he makes it. Usually patients are in fairly stable condition before they're taken to CAT scan, but this was one of the experiences where it was not the case. I think I was running on adrenaline at the time, but thinking back, this was quite a scary situation, and I don't want to go through something like this again. Let me know what your reaction to this story is. I'd really like to hear the opinions from everyone, whether or not you're even in the medical field. It doesn't matter. Tell me what you think. How did this make you feel?